Hi, Anne Marie. This is
Hello.
Jim Marvel. I'm here.
How are you?
Pretty good. Guess it's just you and me, huh?
So far, we got a few more minutes.
Okay.
There's some people. Okay, so we've got a couple people in the attendee list.
All right. There's Ted.
Hi, Dr. Marvel. How you doing?
Pretty good.
Good. You all ready for Thanksgiving?
Oh, yeah.
Good. At least your appetite's ready for Thanksgiving.
Yes, yes.
Just have to get Patty to cook.
Well, I think Steve, her son's going to do the cooking.
Okay, well, that's good.
We took a prime rib over to the house today.
Ooh.
All right. Well, I guess you're not going to have a turkey then.
No. Oh, yeah, we're going to have a turkey also.
Okay. Why not?
Hey, Paul.
Hey, Jim, how are you?
Good.
Mr. Mayor, how are you?
I'm good, Paul. How are you?
I'm good.
Great. And there's
Hi,
Susan
Susan.
already. That's good. She's connecting. And Nancy's joining us. That's great.
I am. I may have to duck out in just a few minutes, but I'll be here as much as I can.
Great. Thank you.
So Ted, I have an administrative question for you.
Yes, sir.
Where on the Lewis website do I find the agenda and the minutes? As I looked, I couldn't easily find it.
Go to the city's website, go to meetings and agendas and minutes. And then you'll see down at the bottom right, you'll see off to the right, you'll see today's date. And you click on there, it says Board of Health. You find it?
Working on it.
Okay. We all do that, you know.
I had to update the operating system on my my Mac a few weeks ago, and although Apple told me it would be better, it's actually slower. So
Yeah, you should have also gotten a, well, you would have gotten a reminder about, just a reminder this morning about the meeting, but
I got an email with the minutes. I just didn't see the agenda.
okay, yeah. The agenda should be when you go to click on meetings and goes to agendas and minutes.
Now, I got the minutes also. But I didn't see any agenda.
It should have been right there.
I'm gonna look
Today,
and
under
see.
today's meeting.
It doesn't look like everybody is in here. I'll have Janine make sure everybody gets on the automatic distribution list.
Yeah, that would be good. Thank you. Sorry about that.
Yeah, for some reason, as I go down and click on that minutes and agenda, it doesn't open up a page for me for some reason.
Okay,
Huh.
that's very strange.
Well, it's likely me and not you.
No,
Well, let me, I'll go ahead and send you a link to the agenda.
Well, actually, I was just able to get it.
Oh,
Did
you
you
got
get
it?
it?
Okay.
Perfect. Yeah.
terrific. Great.
All right. So it's 1:31.
Okay.
Are we waiting for anybody else?
I thought
think we're
Dr.
pretty-
Tam was coming, but I guess if he does join us, he'll catch up.
Okay.
He's not in the, yeah, he hasn't joined us yet. Okay. All right, Paul, go ahead. Great.
So, do you typically take an attendance? How does that
No,
work?
we don't usually. You can
Okay.
acknowledge that the committee's all here, but we don't normally take attendance.
Perfect. Okay. Well, the first order of business is to approve the minutes from the October 26th meeting. I've reviewed those minutes and I find them appropriate the best I can remember.
I reviewed them also. I move that they be accepted.
I second.
The motion is second. Is there any discussion? All in favor?
Aye.
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 Opposed? Perfect. So regarding an update on COVID, sadly, a fair amount has changed since the last time we met. As we all probably realize, the incidence of COVID, both in the state and in the county, has increased significantly. Just from a reference point, so in late September, the positivity rate in Sussex County was plus minus 3.5%. And as of last night, that number is right around 7%. So almost virtually doubled in that period of time. So,
Right.
certainly not good news. Probably not unexpected though. So the hospitalization rates have also increased. Fortunately, they have not doubled, but they certainly have increased both statewide and within the county. And this is very much a day-by-day thing. Currently, the hospitalization rate in Sussex County is relatively stable. It's at roughly about a third of the peak that we saw in the spring, but it's stayed pretty steady over the last 2 weeks or so. Kind of the one concern that I have is that Newcastle County has seen an increase. So Dr. Tam just told me he's having some technical difficulties, but he's trying to get on. So, but anyway, regarding hospitalizations, so Newcastle County seems to have seen an increase in hospitalizations over the last week or so. And history tells us, not only with COVID, but with most infectious diseases, that diseases tend to spread from north to south in Delaware for whatever reason. So I think the next week or so will be really, really telling here in Sussex County. So
Hello, this is David.
David, how are you?
I'm fine. I'm so sorry to interrupt you, Dr. Cowan.
It's okay. I was nervous with you not being here.
No, you've got it. Although I don't know, Dr. Marvel has a tendency to ask some tough questions.
That's okay. I've got him covered today, I think. He and I go way back. He won't be too hard on me. So yeah, with, as we all know, the governor has increased precautions over the last week or two. We'll see how that works out. And we're moving into the Thanksgiving holiday. As I said in the last meeting, just history tells me that the time between Thanksgiving and New Year's, because of the socialization that goes across the country, we typically see a spike in respiratory illnesses. So, cross our fingers, hope for the best. We'll kind of see what's happening. From the vaccine standpoint, there's been a lot of positive news since the last meeting. There are currently 3 different vaccines that either are planning to or have approved for emergency use from the FDA. The Pfizer, which is the farthest along, is they're actually being evaluated by the FDA now. Moderna is submitting any day now, and AstraZeneca will be submitting soon after that. So that's great news. It'll take a while. And remember, it's not just the approval from the FDA for the emergency use. There's also the Advisory Committee on Immunization Practices, which is an arm of the CDC that will have to weigh in on that. I'm told they're actually not even scheduled to meet at this point, but I do imagine they would meet someone in an emergency meeting soon. I think best case scenario is we'll see the vaccine in the state in the middle part of December. Some optimists would tell you a little bit earlier than that, but I think realistically, the best we could hope for is the middle part of December. And as I understand it, the state's plan right now is there's very limited amount that will come into the state. And that's going to be designated for frontline healthcare workers that are dealing directly with COVID. And then soon after that, at-risk populations. I think the question is how much vaccine there is, how quickly you can get through the first responders and primary healthcare providers into that at-risk population. And recall that all three of these vaccines are 2-dose vaccines. So it's a dose and then a second dose 3 weeks later. So it's good news, but I think if we're from a public health standpoint, if we're looking at the vaccine, I think we probably can't reasonably expect to have vaccine available to the broad public until sometime, certainly after the first quarter of 2021, maybe even to the second quarter. So we're talking about, springtime, I think at the least. David, do you agree with that?
Yeah, I think, Dr. Cowan, you're absolutely right about the timeline. What we are hearing is, like you said, mid to late December for distribution to health systems for frontline caregivers. We are talking about whether or not EMS will be part of that or not. And of course, discussing it with the state, who is the primary allocator of vaccine during this initial phase. The other thing I think it's important, and we had the town hall yesterday, was we need to just continue to remind people that even when they get the vaccine, we still probably will need to wear masks for a while, because as Dr. Marvel knows, and as Dr. Cowan knows, getting the vaccine means that if you have virus in your nose or your throat, your body will be able to fight the infection so you don't end up getting sick, but you may still have active virus, live virus in your nose and throat, and you could still potentially be a spreader. You could still potentially be giving it to people. And so, until the thing really starts to pat down, I think we're going to still be in the mode where we'll still have to be wearing our masks for a while and still doing some of these safety processes, like watching your distance and still continue to wash your hands. I don't know if Dr. Marvel, Dr. Cowan have any thought on that, but I think that's one of the things that we as a community need to start talking about, because you get a vaccine, you're good. Not quite.
I think that one of the challenges with the vaccine coming quickly to market is there's a lot of questions that we don't know about it that we'll know over time. For instance, how effective it is for different populations, and are there people that's just not as effective for, or more effective? There's a lot that you would typically know before it comes to market, but because of the urgency of this, a lot of the research is running in parallel. So as Bill Chasnoff, who is our BB's go-to guy for infectious disease, said to me, the problem with COVID is that it's only been around for 8 months. So we're learning and changing every day, something new, and what we thought yesterday is changing. It's probably one of the biggest challenges for me professionally. It just, things change all the time. So.
I thought that town hall was very helpful. Did you have a lot of listeners? Do you know?
Yeah, we think we did, Dr. Marvel. I think, it's one of those things where on Facebook Live, we had about 300 and some people actually watching Facebook Live, but then we've had almost 1,000 hits to the link as soon as it's on and it gets recorded and people can watch it. So we've had continued responses to people watching it. And, one of the things that you may have seen is we spent a lot of time talking about the vaccine, as you know, Dr. Marvel, because I think people have to have some basis of understanding about vaccinations and, the fact that it's safe, the fact that politics aside, it still has to go through ACIP as well as CDC approvals, and that, we need to continue to just push the, the vaccine process. We are, of course, the other part is once again talking about, I just talked with Bill Chasanoff just actually 20 minutes ago, Dr. Cowan, about things like, we need to continue looking at the research that is coming out of these companies, because it's right now all about just efficacy. Efficacy means I got the vaccine and I didn't get sick, or I got, I got I'm blocking on it. What is it when it's not the actual vaccine, it's the placebo. I got the placebo. See, I'm not a doctor anymore. I just play one on TV now. And you get the placebo and I got sick, right? So it's all about efficacy, but the companies I understand are really working then on other things like what is the infectivity rate of people if they got the vaccine. Are they doing contact tracing to see if they are spreading the virus less than the placebo group, in terms of whether or not they are, because that's going to be, I think, the key for us from a public health perspective in terms of continuing to speak at this kind of venue and every other venue about what that means about wearing masks and, washing hands and watching your distance, and whether or not we'll be able to have, activities in the spring in the community or things like that.
Yeah, it's an ever evolving situation.
I have a question, I guess, for Dr. Cowan and Dr. Tam. What are you seeing, if anything, in terms of your own frontline staff and whether or not people are concerned about getting the vaccine? I've heard, that because it's been rushed, and, I think that I keep hearing about people, including medical professionals, being hesitant to get the vaccine until it's been on the market for a while. Are you hearing that from your staff, or, how is the hospital dealing with that?
Well, I think that people certainly have, they recognize that it's new and there's a concern with it, but I think they also recognize the gravity of the situation. And, we're at the point now where, quite frankly, a lot of the frontline healthcare providers have either had COVID or they've had family members that had COVID, and it certainly changes your perspective. Certainly when you see people that are really sick, it's different, and certainly if they're family members. So I think although that conversation is out there, they recognize the importance of it. But as an organization, we have a responsibility to know as much about it as we can, not only for our employees, but for the community. So that's really what David was talking about with kind of studying all the different aspects as it comes forward. But it's a big responsibility for us, without a doubt.
Paul, along those same lines, there was a piece on NPR over the weekend about someone in England who had gotten both doses of one vaccine, and he was commenting about how the reaction was when he got the first dose was very mild, just ran a temperature, went to bed, got up, felt normal the next day. But when he got the second dose, he actually felt like he had more flu-like symptoms. Have you heard any reports of any of that coming out of some of the trial groups?
All I know is that my brother participated in the Pfizer group.
Uh-huh.
And here's the problem: is we're talking about individual people. He too reported kind of the same thing. He got the first dose and commented to me that he thought maybe got the placebo. He got the second dose, and he said he felt like he had sort of kind of mild flu-like symptoms for just a day or two.
Yeah.
In his opinion, and again, that's just one person, he thought it was mild relative to the disease.
Okay.
So
John Yang on PBS NewsHour had the same reaction and documented it last week in one of his reports.
Yeah. So,
And that's one of the reasons why, Dr. Marvel, we went ahead and talked a lot about the vaccine because, and talked about vaccinations, because at the end of the day, that's what a vaccine is. The vaccine is dead virus that we inject into people to ramp up your immune system to develop antibodies to fight the infection if you were exposed to it in the real infection. So people will develop symptoms consistent with that immune response that all of us get when we're fighting an infection and creating antibodies, right? Fever, being uncomfortable, muscle aches. And so far, the studies have been done to demonstrate that they have not been debilitating, nor are really bad, that cause things like neuromuscular problems or other symptoms that can cause, significant autoimmune disease. So it's a safe vaccine, at least at this point, in terms of the research. But yes, it will cause people to feel uncomfortable. Some of them, not all of them. And I think that's, whether you had the flu vaccine, some people feel like they got the flu after the flu vaccine.
Right.
My wife is one of those, and she keeps telling me, why did I get the flu vaccine? Now I feel like crap. And the answer is yes, but it's better than actually getting the real flu,
right,
which can cause significant debilitating illness.
Dr. Tam, Where is the nearest place that has the refrigerator they need for the one that goes to -90 or -70?
The nearest, I don't know. I will check with Bill Chazanoff on this. We do have, of course, a plan where that has been identified, but I can't tell you exactly where it is, Nancy.
But it's not at BB.
I don't think so.
I don't believe it is.
If I may say so, hi guys, it's
Oh,
Cheryl.
hi,
I had to join late. I'm sorry, I was on another meeting, but we have actually ordered a refrigerator. We're waiting for it to come here, the freezer. They're made to an order, so it's not like they have a stockpile of them. So we have ordered that specific freezer and we're waiting it to come. But we do have room for the vaccine when it arrives. We do have something in our lab that can accommodate until the freezer gets here.
Great. That's good to know.
Right.
And Nancy, please know that the freezer at this point, Cheryl probably has more information than I do, is specifically for the Pfizer, I forget the other company's name that is part of that.
Moderna.
No, it's a Pfizer and BioNTech or something
right.
like that.
Oh, okay.
But the Moderna and now the new one, AstraZeneca,
Yeah.
don't necessarily require that level of refrigeration from where we understand. So the refrigeration, that's what we're talking about. It's a fast moving thing, but obviously for the Pfizer vaccination, we have a plan.
They've also
that's-
said that there's boxes being created that have dry ice and you can, so that you can transport them and distribute them. And hopefully that the logistics people in the Army and others are going to be working on that as well.
Yeah, Nancy, this is Cheryl. It can last for 10 days, packed as it is. And then we can keep reapplying the dry ice. So we have several different plans for when the vaccine gets here.
Great.
So what are,
One of the
Yeah.
interesting things I think from the talk that Bill Chasnock gave us last night was that at the time of the Spanish flu, face coverings helped prevent people from getting the flu.
Right.
That's something old and still works.
Right.
But it was controversial then too.
Right.
Could I make a suggestion in terms of your public messaging that perhaps you reach out to the members of the state legislature from this area and encourage Steve Smick and Ernie Lopez and Pete Schwarzkopf and Ruth King and Briggs King and others to be part of your messaging so that you're reaching across the political spectrum so that we're helping people understand whether they're red or blue, they need to take the vaccine.
Yeah. Good point.
Yeah.
Yes.
I have a question about reinfection and, you know, the degree that people who have had it are immune to reinfection. And my understanding early on was that they thought that there was immunity if you've been infected, and now they are seeing more or at least some cases of reinfection. What can you tell us about that?
So the short answer is we don't know.
Okay.
The assumption would be that if you're infected by any virus, that you'd have some degree of immunity afterwards. But we don't really know how long. You know, you can potentially get the flu every year because the flu mutates every year. But we assumed that if you're infected with COVID, that you'd have some degree of immunity. There have not been widespread cases of people getting reinfected. There was a case report with a guy in Washington State, and it has to be a perfect storm to measure this, but he was actually infected in the spring. And then he presented with symptoms again in the late summer. So the virus was serotyped again. Unfortunately, it was done the first time, which most people would never have any of this kind of testing done. And he was found to have been infected with 2 separate strains of the coronavirus. So it is possible, but do we know that that's going to happen on a widespread standpoint? We don't. That's just, you know, that's the struggle with dealing with something that we've known for months and not years.
So if we have gotten the virus we shouldn't let our guard down at all because there's no indication that it's not going to hit again.
Well, yeah. So, and I think there's two really important messages with that, because it's true. If you got the virus once, you may or may not get really sick a second time. We don't know that answer. But more importantly, we don't know if you get reinfected, you just become an asymptomatic carrier because your body has some ability to treat the infection, and then you are spreading the virus unbeknownst to yourself or anybody else.
Okay.
So, as Dr. Tam said, we are in the phase of face mask and social distancing for the foreseeable future. And I can't imagine anything changing soon to really change that.
I do notice that the governor has cut our restaurant and bar attendance at 30% to 30%. But I did notice that in Pennsylvania, they're closing the bars on Thanksgiving Eve at 5 p.m. because apparently that's a big time for rowdiness and drinking. I wasn't aware of that until I found out that the accident rate on Thanksgiving evening is quite high. But has there been any talk about that, doing something like that in Delaware?
Not that I'm aware of. I think most restaurants are closed by 10 o'clock here, both not only in Lewis, but in Rehoboth as well. I know in New York, every restaurant is closed at 10 o'clock, restaurant and bar. So I think most restaurants are following that guideline. But I'm not aware of anything but being said about closing on Thanksgiving Eve. Makes sense that some people, they might go out and party just on the eve of a holiday.
Well, I think they're talking about mostly college
Yeah.
people home for the holidays.
Exactly.
Yeah, I think that I've always historically heard that the day after Thanksgiving is one of the biggest nights for bars, typically.
Right.
So, David, you haven't heard anything like that from the governor, have you?
No, have not.
Good.
I think a lot of our restaurants, because of the small size of them, are going to be heavily promoting carryout rather than serving in. Like some of our very small restaurants could have maybe 6 or 8 patrons at the most, and it just becomes economically unviable for them to try and operate. So, and have the staff they need. So,
Yeah, I'm worried about our local businesses.
yes, exactly.
Yeah, that's. I think that. Yeah, I'm very concerned for our small business people. I think it's going to be difficult for them, to say the least.
Yeah.
So.
Which has created some other problems for people like trash haulers and things, because there's a lot more trash now than there used to be at the residential level. So,
as a mayor, you would understand that stuff, right?
I think you get, not only do you understand it, but you get to live it.
Right. Okay. So the last agenda item, Mr. Mayor, is with reopening plans. Obviously,
Right.
Doesn't sound like we're anywhere near.
No, and we're doing everything we can to try and make sure that the holidays are, certainly as with traditional things that happen early in December. We've canceled the parade, and Santa is going to be in his house, but the children are not going to be able to approach Santa. We've built a mailbox so children can drop off their letters, and Dr. Tam was part of that program the other day. He's appearing in one of the ads. Thank you, Dr. Tam. So I think that, that's going on. Interestingly enough, the Historic Society is going ahead with their Christmas market at the complex. And according to what I've heard from the executive director, they have a plan that's been developed, including temperature checks and social distancing, of course, but also contact tracing that they are going to be required to keep as part of allowing people on the grounds for the 5th of December. So,
is that an outdoor event?
It is an outdoor event. They were given, according to the information I got yesterday, they were allowed to continue, even though the governor reduced functions to 50 people. they were allowed to continue at the 250 level for an outdoor event. So obviously they're doing all they can to be as safe as possible.
Yeah.
I think, the house tour, which is always a big popular event for the city, is being done virtually this year as opposed to anything physically. But I think we're continuing the face mask requirements, and actually our Santa is now going to be wearing a face shield as opposed to a mask. The mask and his beard just don't get along, so he's going to wear a shield. So, but I don't see us changing our policies at all in terms. And as we get further into winter, it's going to be harder for people because of another piece of equipment they need to put on to go outdoors. And,
Yep, it's going to be a challenge. There's no doubt about it.
how is the hospital doing in terms of censuses? Are you seeing a marked increase in patients here? Are you, is it
So
manageable for you?
yeah, so our census has returned to kind of what we described as a typical level. Certainly there's like as a decent part of that, which are COVID patients now.
Mm-hmm.
But we're busy, but we're not overwhelmed at this point.
Good.
Cross our fingers and hope that we don't get much busier than what we are now.
Okay.
We're just a little bit busier than we would be this time of year.
Mm-hmm.
But from a perspective standpoint, not quite as busy as we would be during the summer.
Okay.
So.
How about, I know you've had great amounts of flu vaccine clinics available. Has that continued to really be very well received? I know you reported the last time we got together that we'd had a great number of people who had taken advantage of it. Is that number continued?
David, I'll give that to you. I'm not sure from an organizational standpoint, or many more people we could give the flu vaccine to. We covered that many that quickly.
We have both the both the workers here at BB have, really in a span of basically 72 hours, although we did vaccinate in 48. So 48 hours, but of course, recognizing that, some people don't work, they may be 4 on, 3 off or whatever, but we vaccinated a substantial number of people for our own employees. And we have also then done the vaccinate in 48 in terms of 48 sites throughout the community. Epworth, for example, was a big area, a place where we did. And we've really, we've done almost, we've done a significant increase compared to last year at this point in terms of the number of flu vaccines that we've given out.
Great. And testing for COVID seems to be pretty well available, although those sites are filling up pretty quickly. But I do hear people are, getting in pretty quickly, which is great. And I had one done. I had a test done last week. I was amazed how quickly I got the results via text, which is very encouraging for people.
Yep.
Good. Probably one comment for public consumption with regards to testing is that I think there's a notion that if I get tested, I'm safe to be around people.
Right.
And it's just, it may be true for the hour then you were tested, and that was maybe about it. I hopefully people don't take that tack for the holidays.
Mm-hmm. Yeah. Okay.
All right.
I don't see anything in the chat. Do you, Anne Marie?
I do not.
Okay.
Good. Shall we look for a date for the next meeting then?
Sounds like a great idea. We've been working on about a 3-week schedule. Does that work for you, Dr. Cowan and Dr. Tam? Your schedules are much tighter than ours at this point.
So December 15th?
That would probably work if that works for you.
Okay.
Doc-
And what time of day is best for you? I do appreciate you all being amenable to rescheduling what we were going to hold last week.
Sure. David, what's your schedule like on the 15th, or do you need to talk to Lynn about that?
Well, once again, I know we're public, but I will tell you that in the true vein of being the woman behind the man, she has already told me 2 or 3 on that day. Well, I'm still trying to figure out how to open Outlook and get my calendar up. So 2 or 3 are fine with me.
Okay,
So should we do 2 o'clock on the December 15th?
available on my schedule.
Good.
The only
Hey, with
thing,
me.
the only thing I would say is like right now, the governor does his press conference typically at 1:45 on Tuesday. So if
Hmm.
anybody was interested in seeing the governor's press conference, they're choosing between this and that. So I don't know, should we try 3 o'clock so that it would be after the governor's press conference or toward the end?
That's fine.
3 o'clock.
3 o'clock then.
Yep.
Yeah, and FYI, the governor has was normally have had his conference with mayors this morning. He postponed it till Monday. And he wanted to see what happened after the holiday. So we'll have a conference call with the mayor or with the governor on Monday the 30th. So if there's anything out of that, we'll share it, I'm sure.
Okay.
Okay,
So the 15th at 3 o'clock.
sounds like a plan.
Great. All right. Thank you, everyone.
All right.
Thank you and happy Thanksgiving.
Thanksgiving.
Thank you for,
Happy Thanksgiving.
Thanksgiving.
See ya.
Yeah.
Please take
Yeah.
care.
Happy Thanksgiving.
bye-bye.
Bye.